Good morning. This meeting of the Baltimore City Council Health, Environment, and Technology Committee is now called to order. I'm Councilwoman Danielle McCray, also chair of the committee. In attendance, we have Councilman John Bullock from the 9th District.
Thank you, Madam Chair.
Thank you. We have Councilman Mark Conway from the 4th District.
Thank you, Madam Chair.
We have Councilwoman Felicia Porter from the 10th District.
Thank you, Madam Chair.
And we have Councilman Isaac Gitsy Schleifer from the 5th District. Councilman James Torrance has an excused absence. He is reporting to jury duty today. Councilman Ron Dorsey is absent at this time. We are also joined by Councilman Robert Stokes of the 12th District.
Madam Chair.
Thank you. From the mayor's office, we have Nina Themelis, and from the council president's office, we have Nikki Thompson and Matt Stegman. Also in attendance, we have Matthew Peters, staff to the committee. Before we get started, I just have a couple of ground rules. Please stay muted until you are recognized by the chair. Please mute yourself when you are not speaking. Before you speak, please identify yourself, the agency or organization you are with, and your position. Please speak slowly and clearly. And after you finish speaking, please mute yourself again until you are recognized by the chair. We do ask that committee members and city agency officials keep their videos on for the duration of the hearing unless there are technical difficulties preventing you from doing so. This is for transparency's sake, so members of the public know that we are listening and paying attention. Last, for members of the public, there will be an opportunity for public testimony. You will have 2 minutes each for testimony. The committee is hearing 2 resolutions today. Resolution 21-0052R, informational hearing, Baltimore City employees safe transition to work after COVID-19, and Resolution 21-0005R, Department of General Services update on sanitizing city-owned buildings. We are going to start with Resolution 21-0052R for the purpose of inviting the Baltimore City Administrator, the Director of the Department of Human Resources, the Commissioner of the Baltimore City Health Department, the Director of the Department of General Services, the Director of the Office of Emergency Management, and the Baltimore City Safety Czar to appear before the City Council to discuss the plans and strategies that are being developed to transition Baltimore City employees back to safe, physical work environments. For this hearing, we will have brief opening remarks from the sponsor, which is myself. And then we're going to hear reports from our agencies and give committee members the opportunity to ask questions. After that, we will move on to public testimony. The health and safety of our Baltimore City employees are a paramount concern in regards to a safe transition back to an in-person working environment. We must develop and implement workplace safety and health guidelines to reduce employees' fears and provide for a safe transition back into the physical work environment. We fully understand that there is no one universal plan to ensure the safety of all city employees, as our city employees work within different settings and spaces, which call for very specific safety measures and precautions. We also know that our employees are the backbone of our city, and the HEC committee wants to ensure that we are being proactive and thoughtful now before returning all workers back to the physical workplace environment. At this time, we're going to hear from our agency representatives, committee members. The Restoration of Services Committee will be providing a presentation, and then we're going to hear our agency reports. Last, committee members, I'm just asking that you hold your questions until we finish the presentation and hear from all of the agencies. And for the RSOC, whenever you guys are ready with your presentation.
Yes, Madam Chair, do you hear me?
Yes, I do.
Okay. We do have some slides that we'd like to present. My name is Todd Carter. I'm the director for VSIT.
I'm so sorry, Director Carter. I'm going to cut you off briefly. I just want everyone to know that Councilman Ron Dorsey from the 3rd District has joined us. Thank you, sir.
You're welcome. My name is Todd Carter. I'm the director for VSIT. I'm here with my colleagues, Dr. McDowell from the Health Department, Quentin Herbert from the Department of Human Resources, Chi Nyaga Nash from General Services, and we represent or a few of the members of the RSOC committee, which we'll talk about later. This committee has been working since 2020 of March, and we have been working with guiding services back to restoration since then, and making sure that we provide the necessary training and guidance to keep employees safe and to keep services open. So we have a short slide deck, and then we'll be open to questions, and a number of the committee members may be called upon to the question at hand based upon what is asked. Next slide, please. First of all, Mayor Scott, the CAO, senior leadership team, and the RSOC would like to recognize and salute the services performed by public service, health, and other Baltimore City agency personnel who perform these essential services independent of family challenges throughout the entire pandemic. That's not only now, in the past, but also in the future. The mayor thanks you for your commitment and your unwavering public service. Next slide, please. So this is the structure of the Restoration Services Oversight Committee. I'll talk about it overall and then get into some of the details, where at the top you have the mayor, the CAO, and the senior leadership team. They are accountable for setting goals, policies, and standards, the strategic decision-making regarding those policies or major resource allocations. And they set that. We, as part of the oversight team, the RSOC team, we're accountable for the oversight of those set policies, those set guidance, and those set goals. And we assess the procedural execution as well as manage gaps to meeting those goals. We oversee and manage the support teams, which you see below in the bottom boxes. And we set clear expectations for planning and execution at the agency level and ensure that we are coordinating and partnering with agencies as we go to execute on those policies. Our members include members from DHR, DGS, OLC, BCHD, BSIT, the Mayor's Office, and OEM. And our support teams are a number, and they provide the support for the agencies. You know, the agencies are the implementers of those policies, but they're also needing support from our HR Strategies and Policies Group, the Occupational Safety and Health team, the Logistics, Facilities, and Equipment team, and our Communications team. So this structure has been in place. It's designed to work so that we provide the alignment not only to the individual agencies that are performing the work, but provide that alignment from the very top of the mayor, CAO, and leadership team all the way through the administration. And we've been working as a matrix team for some time now. Next slide. We have several guiding principles, which I'd like to review. The first one is that safety is our highest priority and includes the safety and health of our employees, their families, and residents of Baltimore. Baltimore will safely and incrementally move forward with accessibility to the public, but also be prepared to step back if public health and safety requires it. Throughout this presentation, we're going to reiterate that particular principle because we recognize that this pandemic is ever changing and we will have to change with it. We follow CDC, OSHA, health authorities and state guidelines in decision making. And we recognize that a return to normal or the way it was before COVID-19, one, that's just not our goal in all cases. And in some cases, that may not be possible. And then lastly, agencies follow Baltimore executive leadership approved principles, timelines, and guidance. We provide the oversight with specific customizations based upon specific operating needs, and recognizing that all agencies, there's no one size that fits all. Next slide, please. I'm going to ask Dr. McDowell to talk to the next two slides. Dr. McDowell. Does Dr. McDowell have speaking privileges? I'll ask the coordinator of the meeting.
Apologies, I was muted. Hi, everyone. My name is Dr. Kendra McDowell. I'm the Chief Medical Officer of the Baltimore City Health Department, and I represent the health department on the city's RSOC. I'm just going to provide a brief high-level overview of where we are as a city in regards to cases, and then provide a little bit more information around vaccinations. So as you can see right now, this data is as of yesterday. There have been 12.0 cases per 100,000 individuals, new cases over the past 7 days. And there has been a 517% change in cases from a month ago. In terms of deaths, we still have 0 new deaths per 100,000 individuals over the last 7-day period. And our percent positivity has increased close to 400% from 4 weeks ago, and is now at 3.1%. This is in line with what we are seeing across Maryland and across the nation in regards to increases in cases. Next slide. So in regards to vaccinations and what the city is doing, currently as of 8/16, 323,000 residents of all ages have received their first or single dose. That's about 54.5% of the entire population. For our adult population, 18 and older, we are at 65.1% of the adult population has received a first or single dose. For fully vaccinated of all ages, we are at 48.3%. In regards to the number of vaccinations for Maryland, as of 8/16, for the first dose, 61.6% of the entire population has been vaccinated, and 55.6% of the entire population has received their second, has been fully vaccinated. The health department, in terms of city residents and city employees, has held multiple town halls. This is just a segment of the town halls that we have held for city employees and also city residents. By myself, there's been 31. In particular, the city safety czar, in concert with the health department, has planned 5 employee vaccination clinics that have been held. And there are additional ones that will be coming in the fall as well. In regards to overall as a city, we have, as the health department and health department involved clinics throughout the city, there have been 735 clinics that have been held for vaccinations. And we also have a homebound program where there have been 408 homebound residents as of 8/16 that have been vaccinated through this program.
Thank you, Dr. McDowell. So the reopening public access to front-facing services, just to put some context around it, as of the 9th of August, Mayor Scott in Baltimore City has instituted a masking policy for all indoor activities. and our current Baltimore City guidance that face coverings will continue. Vaccination incentive, that's under review by the senior leadership team. Social distancing, we're continuing. And the entry and exit to buildings will continue using the EMOCA app. And what we're going to do a deeper dive into today is the opening of the front-facing public services, front-facing services to the public. That's in progress. Next slide. So a few reminders. Baltimore City COVID-19 policies and guidance will change as Mayor Scott, the CAO, and other SLT and the SLT evaluates and sets policy based upon new data from BCHD, CDC, and other official data sources. We are in that type of environment where we do expect our policies and guidance to change. And also, and this is part of our overarching communications to our residents and to our employees, that as resident-facing services are restored, and at this time, residents are strongly encouraged to continue accessing city services online unless in-person assistance is needed. Next slide. So here are some of the directions that we have relative to moving Baltimore forward that balances the pandemic, social, and economic trends that we see. First of all, Baltimore City has been open for business. We've been relying on and performing those services via online. We've been doing it with modified schedules and practices, and our first responders have been on the job day one, whether that's police, fire, OEM. They have been on the job, health, since the pandemic, providing services to residents. Baltimore, we began restoring services to prioritize front-facing services by August 15th. The actual date is the 16th, and that started as of Monday this week. Those employees who can effectively telework today and are not needed for those front-facing services to open publicly will be allowed to continue to do so. And Baltimore will strongly encourage all employees to be vaccinated. To protect our unvaccinated employees in an equitable manner, we will continue to require masking indoors for all. And then lastly, as I mentioned in the other slide, Baltimore plans to incentivize vaccinations and track progress of city employees who are vaccinated, who voluntarily submit that vaccination status to us. So when you look at our plan, it's a phased approach. There are sort of three key timelines, three key phases. Phase one, which we're in right now, but the initial planning phases of phase two for October 24th, and then phase three with the restoration of in-person services at 100% for January 2022. Keep in mind the guidance I gave earlier that these dates, these policies, these guidance may change based upon what we see on the ground, but also pointing out that we will continue as the RSOC to revise these dates for these services under the guidance of Mayor Scott, CAO, and the senior leadership team and the Baltimore Health Department. We also recognize that the Baltimore Health Department, Dr. DeRiza, has been in constant daily contact and counsel with the mayor and his staff. And so we feel and see that the decisions that we make are based upon the best available data at the time from BCHD, the CDC, OSHA, the state of Maryland, and other information. And we also work in concert with, in consultation and partnership with agency heads and their leadership teams on an ongoing basis. So we're in phase one, the restoration of services. We call that the early reentry phase, and we are planning for phase 2 and 3. Some of the parameters we use, first, we just recognize that those critical employees needed for essential services are continuing to work. We recognize that we will begin the gradual return to provide these resident-facing services based upon the operational performance, the strengthening the economic prosperity of Baltimore City, but also doing that in a safe manner. And then lastly, employees who can perform their duties remotely will be allowed to do so with agency approval. Employee telework and on-site work schedules are set at the agency level. And as I mentioned earlier in the presentation, this principle at the very bottom, we will safely and incrementally move forward with accessibility to the public, but will also be prepared to step back if public health and safety requires it. Next slide, please. So here's our process for reopening. As I mentioned earlier, Mayor Scott and his team will set overall goals, strategy, and guidance for the services to reopen. We, agencies and the offices, complete a RSOC reopening safety checklist. This checklist is a proprietary version from the CDC that has been customized to help us by our safety czar in Baltimore. And just as sort of a reminder, on an ad hoc basis, we have been fielding requests for different services to reopen, different services to modify, or for services to make changes to their delivery throughout the entire pandemic period. So once we get that checklist, we review it. If remedial actions are needed, that's when the support teams that we identified earlier come into play to help all the agencies, fill those gaps. Those gaps could be anywhere from making sure that they have the proper PPE, the proper plexiglass spacing, all of that. And then the RSOC will approval. We will give them a date, an agreed upon date, and at that point in time, we activate our communications team, and they will put notices out to the public, the employees, and others who are looking to receive those services. And so all of the services that you see today have started opening on Monday, have gone through this process. The services that are in queue are going through this process. And maybe some services that you think should be open still may need additional safety precautions added so that they can open safely to the public. And that's what our support teams are working with them for. Next slide, please. Our communications team has been reformed, and they are looking to provide all the information across a broad set of stakeholders, including the employees, residents, and other stakeholders, just so that everyone can be fully aware. Their actions are to support Mayor Scott and his press needs and announcements, but also to deliver timely messaging to residents, employees via the internet and intranet, internal versus external web, social and print media platforms, media interviews, as well as building scorecards and trackers so that we can, on some summary basis, look to see how we're performing and what else is needed for us to perform and communicate effectively to all the stakeholders. Next slide. Precautions. As I mentioned, when we look at reopening, we look at it not through the lens of just let's reopen the services, but how do we do that safely? And how do we do that in a way that doesn't put employees, residents at risk? We are encouraging residents to continue to use the online services where possible, but also seek in-person service when those options are exhausted. We recognize that some of our residents do not have the same access to computing resources as others, and so we want to make sure that they have access to these services. Masking is required for all indoor activities. Distancing guidelines still apply, and where we have services that are open to the public, the line and queue management, especially for those high volume areas, is critical to maintain space, maintain PPE guidance, and also just to assist the enter and exits of individuals safely. We provide mask, hand sanitizers, and contact tracing capabilities. And additional safety materials have been supplied for those services that are high volume, high touch, such as plexiglass, and other spacing protocols. Again, this is a benefit to our employees and residents as well. We recognize that some of our employees have hesitancy and safety concerns, and to work with those concerns, there are frequent communications by the leadership leveraging the RSOC resource guide. This is a guide that's put together for every supervisor that gives them a reference for instance, how to request a cleaning, how to report a safety violation, how to get supplies. This resource guide is in the hands of all supervisors. We also meet with our leadership team on a consistent basis, and every agency head too. There are ongoing health department employee town hall meetings, vaccination drives, and messaging that comes out consistently, not only on the scorecards, but via our internet. We also have a 311 COVID workplace safety line where employees can anonymously communicate a safety violation or concern, and the next concern comes directly to the RSOC, who will have our safety czar and team and others research and rectify if necessary. And then we have a number of team up, we call them team up vaccination ambassadors, about 30 of them across all of Baltimore City. They do a number of duties in terms of the safety check-ins on a daily basis, any safety violations, communications. They are our eyes and ears and tool to help spread this message of safety, safety, safety to employees throughout Baltimore. Regarding the dissemination of information, I mentioned the socialization of the resource guide that's emailed directly, and our intranet and internet sites and other media is updated on a regular basis by our communications team. Next slide. So next steps, we've reviewed our current state and next steps for reopening with the agency heads. That occurred last week, and we got all of their go-ahead to do that. We distributed the resource guide to leadership and supervision. Communication to employees regarding restoration efforts, schedule, process safety guidance, that has been completed. Our communications group will begin stakeholder communications, which has already started, and planned announcements, which have occurred as well. And then the initiation of the Vaccine Awareness and Incentive Program is still ongoing. And then in planning, just the ongoing monitoring and assistance and monitoring of public-facing service reopenings. We had people at the Abel Wallman building on Monday, and as well as the Benton building, looking at the queues. We even had a couple of challenges with the Amoca app that we had to resolve fairly quickly, but we weren't able to do that without the oversight team executing their role, making sure that we understand what's going on at the ground level and making adjustments. Planning as next steps, as well as phase 2 and 3, the restoration planning and communication, that's upcoming. And then lastly, directors Herbert, Chi-Chi, I'm sorry, I sometimes have trouble pronouncing her last name, and myself are part of the Reimagining Workforce pilot. This is a pilot that will look at different ways we can we can work in Baltimore City with respect to telework, common workspaces, flexible spaces, recognizing facilities and real estate savings and technology needs. This team has been meeting for a number of months now, and will soon be at a point where we'll be able to share our findings with this committee as well. But it's in recognition that the world that we are in has changed significantly since COVID-19. The employees' expectations have changed. That's something that we've surveyed and gotten a lot of data about, and we've used that data to help figure out how do we best move forward in a way that we still provide excellent customer service to our residents, but give our employees and our leadership flexibility to provide that service in ways that's safe and conducive to the technology that we've been using over the last 18 months. So, Madam Chairwoman, those are our slides. We have in this deck that we will certainly send out the services that are open, but those services are also on our web pages, and residents and others can pull them up right now as to see the most up-to-date service status that we have, but they are in the appendix of these slides. There are probably about 30 additional slides after this last slide. And with that, I yield to Madam Chair.
And thank you, Director, and also Dr. McDowell for the presentation and for leading the presentation so we have this information. At this time, we're going to go through the committee reports or through the agency reports. Many of the reports, committee members, as you know, it's deferring to the presentation that we've just had. So for our agencies, if you stand by the report, please state that. We're going to start with the city administrator, please.
Madam Chair, the presentation stands for the City Administrator's Office.
Thank you. And I believe, was that Nina Themelis?
Yes, Madam Chair, Nina Themelis with the Mayor's Office of Government Relations.
Okay, thank you. We're going into the Department of Health.
Good morning. This is Letitia DeRosa, the Health Commissioner for Baltimore City, and we stand by our current report, deferring to the RSOC.
Thank you, Commissioner. We're going to the Department of General Services.
Morning, Madam Chair. This is Chichi Miyaganesh, Director of the Department of General Services, and we similarly stand by our response that gives deference to the RSOC presentation.
Okay, thank you, Director. We're going to go to the Department of Human Resources.
Good morning. Thank you, Madam Chair. Quentin Herbert, Director of Human Resources. We stand by our report, which also defers to the RSOC presentation.
Thank you. The Mayor's Office of Emergency Management.
Good morning, Madam Chair, members of the committee. The Office of Emergency Management too stands by its report, defers to the RSOC committee. Thank you.
Thank you. And last, our City Solicitor.
Good morning, Madam Chair. Elena DePietro from the City Law Department. The Law Department stands by its report and finds that the bill is legally sufficient.
Thank you to our agency. I'm going to open the floor to committee members for questions. Committee members, if you have any questions, please signal or use the raise hand function if you have a question for a specific agency. I'm going to go ahead and start at this time. Director Carter, you did mention, you mentioned briefly and in some areas just about communication. Communicating new policies and a new normal for the physical work environment at the earliest possible date. We know that it can help manage that anticipatory stress and create the opportunity for employees to plan for changes to their lives and health needs. With that in mind, can you speak more in depth about the city's plan to proactively communicate with city employees about the safe transition back to the physical work environment and the new guidelines and initiatives?
Sure, Madam Chairwoman. First and foremost, we have been communicating via a number of methods to city leadership and city employees with the expectation that leadership does push down the message. But we recognize that sometimes that doesn't work in all cases. And so what we've done is we've stepped up our communications by bringing in not only the communications team, but the PIOs of these agencies that can also help us get the message to employees in a timely manner. And when we looked at our schedule for reopening, one of the considerations we had and baked into the schedule was roughly a 6-week time frame that would allow employees who would have to come back to work to provide in-person services to give them enough time so that they can make arrangements. They can work with their leadership if there are any exceptions, and that they can come back to work safely by understanding all the policies, all the procedures and protocols that are in place. So we've done a number of things to make sure that we are communicating on a consistent basis to our employees. We have regular monthly meetings with all of the agency leadership to pass this information down. And we also have an OEM call that occurs monthly too, where we provide the status of our service restoration efforts and safety efforts throughout the city. So there are a number of means, a number of methods we use to communicate, and I'll just ask my other team members if there is anything else to add, or if I missed anything.
Madam Chair, this is Chichi Nyaganash. Just want to add one additional resource, which is out there for everyone, and Director Carter mentioned it in this presentation, and that is the resource guide. It's available not only to supervisors, but to all city employees. And within that guide, we've embedded questions, FAQs, based on what we believe would be employees' questions, what we know based on questions that we have fielded. And it's a living, breathing document, and so it is updated regularly. And within that, we are able to either anticipate or respond to questions that the employees might be having and concerns about returning to the workplace or continuing to be in the workplace for those who never left.
Thank you, directors. Director, can you just let me know, just for the record, exactly where the resource guide and for our employees, if they're going to be watching later on Charm TV, or if they're going to be watching on our Charm TV Citizens Hub, where exactly is the resource guide located for everyone to access it?
If the resource guide is not there, if it's not already there, it should be on our intranet site. We certainly mailed it to all the leadership. I would have to just validate that it is on the intranet site. We do have a resource portion within our intranet site. You do have to be connected to our network to actually get to that. But it just confirmed it is on the intranet site. So if someone opens up a browser, you should get the Baltimore City intranet. And sometimes we call that browser a splash page or whatever, but that's the first page you see when you open up a browser, and it is on that browser.
Thank you for clearly stating that it is available on our intranet. The other question that I have right now, how we spoke about a 6-week period between letting workers know that they'll have to go back to work. How are we considering mental health as part of the transition back to the physical work environment? And what services do we already have in place to support our employees who will be returning?
I'll defer to Director Herbert and the Health Department on that one.
Good morning again, Madam Chair and committee members. The Baltimore City Employee Assistance Program, or EAP, which is housed in DHR, has been available to employees throughout the pandemic and has been providing those counseling services to our employees who have been experiencing anxiety and stress for a host of reasons throughout the pandemic. They remain available to employees as they return to work. We extended office hours through the pandemic. Previously, EAP had office hours of 8:30 to 4:30. We have done some rearranging so that we can remain available to our employees from the hours of 8:30 to 6 p.m., understanding that not all employees can access EAP during the workday. So we've provided for some additional coverage in those early evening hours for employees to be able to access EAP for those who have those issues.
Thank you. We're going to move to Councilman Conway for questions.
Thank you, Madam Chair. My questions are really based on our timing. Now we know this virus is consistently changing, and we have currently a confluence of two major issues happening now. We're seeing the vaccinated folks' immunity wane, while we're also seeing a more virulent strain with the Delta variant. I'm curious if this confluence of issues has at all changed how we're going about reopening. Has it changed our timeline? Has it changed anything about what we're attempting to do? And also, has it at all changed how we're communicating with our employees to let them know that although they are vaccinated, they are still at a risk that they may not have been aware of? How are we thinking about that?
Can I ask Director Herbert and Dr. McDowell to opine on that first, please?
Yeah, I would defer to Dr. McDowell. What I will say preliminarily, that we did consider that. We consulted with the health department, and as we mentioned in the presentation, we defer to the guidance of the CDC, the Baltimore City Health Department, and those other agencies for guidance around safety and reopening. And I know that we considered our current numbers in that consideration. However, I would defer to Dr. McDowell on that.
Yes, the RSOC is reviewing all of the data around the epidemiology of COVID-19. The new information around the Delta variant is emerging. And we are also, as the health department, making every effort to ensure that employees have access to the vaccine and are getting the information that they need about the vaccine through town halls.
And Councilman Conway, the other thing that I will add is from a communications perspective, we know we are going to be in this situation for the long haul, and that's why we've reactivated our communications team under the leadership of the deputy communications role with Stephanie Mavronis. So that is something that we know those internet and intranet sites need to be up to date. We know we have to continue to meet with leadership on a monthly basis and sometimes call ad hoc meetings when and if either our guidance changes as a direction from the mayor, CIO, and the senior leadership team, or there's more information that we have to get out. So tying both what Director Herbert and Dr. McDowell said, communication is the key, and we believe that we're set up for the ability to communicate quickly and broadly across a number of mediums that are at our disposal.
Thank you. I appreciate that. I want to just sort of bring home the point here, and I appreciate all the work you guys are doing on this. You clearly have put a lot of thought into pulling together this plan, and it shows. I want to make sure we don't miss the opportunity to also make it very clear to folks that they're not off the hook if they've been vaccinated. And especially if you've been vaccinated 6-8 months ago. So I just want to make sure that folks are aware, and we're thinking about how we can communicate that to folks that may be going back in person. It could be a huge vulnerability in our plan if we don't consider it in advance. Thank you, Madam Chair.
Thank you, Councilman Conway. We're going to move to Councilwoman Porter.
Thank you so much, Madam Chair. I had one quick question related to protocols for city buildings. Can you explain the protocols for sanitation, protocols for ventilation of city buildings as more and more people are coming back to work? But then also on the flip side, those city employees that work outside of their buildings, like sanitation workers, like other people that not necessarily work in an office space. Can you explain kind of like their sanitation SOP protocols as well?
Director Carter, are you deferring to me on that one?
Yes, the video from Councilwoman Porter showed you talking, but the voice had stopped, so I was waiting to see. But yes, please go ahead.
Hi, good morning, Councilwoman Porter. So some of the protocols that so just make sure I cover all the points that you raised. You want to know about sanitation in the buildings. You want to know about air quality within those buildings and what procedures individuals who do not work within the confines of four walls in a city facility. So for the first one, as far as sanitation goes, and I'll be happy to dig into this a little deeper later on in the hearing when I'm responding on behalf of DGS on our sanitization efforts within city buildings. We, at the beginning of the pandemic, changed the scope of services that we receive from our janitorial contractors. So in the buildings that DGS manages, at least, and this differs because for some agencies like Rec and Parks, this service is provided by in-house personnel. So I'm speaking specifically of the ones that DGS manages. In those, the janitorial service is provided by third-party vendors. And so what we did was increase the scope of their investigations to increase the number of times that they clean certain areas like bathrooms and common areas, to specifically require that they are using cleaning products or sanitization products that are recommended by the CDC in their frequent wipe downs of high touch points. High touch points being places like elevator buttons or stairwell banisters, common areas where individuals will be touching the surfaces frequently. So we did that. Additionally, we have put up a lot of signage in the buildings regarding washing your hands frequently, other COVID protocols and good hygiene practices. Within our buildings, there are numerous hand sanitizer stations that have either been hard installed into the building or have been put in with freestanding standing hand sand stations. Trying to think. But yeah, so frequency of janitorial services has increased, hand sanitizer in the buildings. We recently, as we were preparing to open back up as part of phase 1 to the general public, we have supplied the guards at stations with masks for individuals who may have forgotten their masks as they're entering their buildings, since that is an requirement. So that's if I remember anything else on sanitization, but those are the big things. As far as indoor air quality goes, that is definitely a concern that we hear often from employees. And the request that we hear is for increased or for a visual presence of additional filtration. So primarily installation of standalone HEPA filters. What we are doing is following the guidance from ASHRAE, from the CDC, from the Institute of Architects, and guidance coming from those organizations is that as long as there is adequate, and there's a calculation for what is considered adequate, but adequate exchange of air from the outside into the inside of the building, the level of the system filtration, whether it's MERV 9, MERV 13, is adequate. So we are only considering putting in standalone, essentially HEPA filters in spaces where we have done indoor air quality assessments and determined that there is not an adequate flow of air. Otherwise, all those spaces are good for occupancy. In regard to the individuals who work outside of city buildings, and you called out individuals such as the DPW sanitation workers, there are sets of guidelines for how city vehicles be getting sanitized at the beginning. So very early in the pandemic, fleet management did a lot of research and found sprayers that could be used for disinfecting. Every vehicle that comes into a fleet facility gets disinfected before a technician gets in to start service. We have shared that information with agencies. They have started using it at their yards. So vehicles are sprayed down with a disinfecting solution at the beginning, at the end of every shift is what the protocol calls for. Additionally, this has been the guidance coming down for months, and it's incumbent upon agencies to continue preaching this message. But for services where it's not possible to restrict the occupants of vehicles to just one occupant, it is critical that all the occupants of that vehicle remain masked throughout the entirety of their shift. So that hopefully that covers the 3 points of your question. And I'm happy to answer anything additional if you have any.
Sure. So I do have, oh, I'm sorry, Madam Chair. May I ask my second question? It's directly related.
Of course, Councilwoman Porter, I just want to note, just for our other committee members, we are having a hearing, Councilman Stokes' bill directly related to the sanitization of city buildings. But yes.
Thank you. And I'll also bring up this type of questioning at that hearing as well. But one of the things, Director Chichi, that was not mentioned was the carpet cleaning and sanitation of carpets within city buildings. Have you all thought about that as well?
It's definitely something that has come up, something that we have looked into. And again, CDC, everything we are doing is in accordance with the CDC. And so that was a topic of discussion early on about the frequency with which carpets would need to be cleaned or sanitized. It was determined that that surface does not require any additional, the level of service that we are providing there is adequate.
Okay. Thank you so much. Thank you, Madam Chair.
Thank you. Before I continue with the second round of questions, I want to see, are there any other council members at this time who have questions for this particular hearing? Okay. Seeing none, I'm just going to go ahead into my additional questions. And bear with me, guys. Thank you. So my next question, and this may be for our health department, there have been conversations surrounding the mandatory vaccination of city employees within our federal offices on a state level. Is that something that Baltimore City is considering?
I know that city leadership has been having active discussions around this with input from many members who are actually on presenting at this committee today. So I know that that's been in discussion at the city leadership level. So within the mayor's office.
Okay. Do we know within this particular committee when we will have some type of announcement about it?
I would defer maybe to Nina if she's on the line, or someone from the mayor's office.
Hi, Madam Chair, Nina Themlis with the Mayor's Office of Government Relations. I don't have a good response for that, but I'm happy to bring that back to the mayor's office and follow up with you.
Thank you, Nina. The next thing that I want to know a little bit more about is that we talked about incentives. I think that it's a good idea. It's what other cities are doing, other states are doing to make sure that their employees are making an informed decision, as well as that they have options, or just encouraging them. So incentives, I feel, are a great idea to encourage participation and have more folks get vaccinated. Can we explain a little bit more about the incentive program that we briefly spoke about during the presentation?
Madam Chairwoman, I don't know if it's appropriate for us to get ahead of the mayor and the senior staff in, the vaccination incentive program. I would, if anything, defer to Director Herbert if there's something that he is aware of that is open to share at this point in time.
No, again, Madam Chair, thank you for the question. Quentin Herbert, Director of Human Resources. Again, I would defer to the mayor's office, and I think that's something we can get back to you on about when an announcement will be forthcoming around the vaccination incentive program.
Nina, what I'll say is, Nina, can you just make sure that we just keep the committee updated on any forthcoming information regarding the incentive program that was briefly mentioned during the slide deck?
Yes, Madam Chair.
Thank you. I did have one additional question, and this may also just be for our health department. I know that we have had multiple vaccination efforts that were targeted directly towards our city employees. Is there any data that we have regarding the vaccination? How many city employees have been fully vaccinated or even have had one vaccination at this point?
Yeah, I might actually defer to DHR, who helped support those efforts and was keeping some track of who was vaccinated when.
Yes, Madam Chair, we right now we're receiving that information on a voluntary basis. What we were able to do is to determine that the vaccination rate of our labor force mirrors that of the general population. And so we have begun to make preparation for how we will attack that. Again, we're still working through what that will look like in terms of a vaccination strategy for our employees.
Okay, Director, I'm going to just go back to one more item that's within the presentation. I think it was Dr. McDowell who mentioned, or maybe it wasn't, I'm sorry, who mentioned that we were going to be rolling out some type of mobile vaccination plans for the fall for employees. Are we able to speak a little bit more in depth about those mobile vaccination rollout for city employees, knowing that in phase 3, we're saying that in January, we want everyone to be back who can be back. So can we just get more information about those?
Yes, I'll provide some information, then also loop in and defer to our city safety czar. So we will be providing vaccination clinics for city employees throughout the city government, and bringing vaccinations particularly to those areas that we know are front facing, and there might be limitations in them coming to the stationary vaccination site that we've had so far at War Memorial. So those plans are ongoing, and the vaccination clinics are going to be rolled out this fall. We've had 2 already this summer, and we're going to be having additional ones this fall. But definitely, the city safety czar, if you have additional information to provide, that would be great.
Hello, good afternoon, Madam Chair. Thank you, Sebastiana Gianchi. Yes, the Vaccination Prioritization Working Group has determined that there will be 5 mobile vax locations this fall. That means 10 actual vaccination clinics, because we are doing the 2 doses of the vaccine. So we have those slated. We have a methodology for how those locations have been chosen. The VPWG has approved that methodology, and it's really based on where we can get the most bang for our buck in terms of how many we can get vaccinated. But I'm happy to answer any further questions you might have. Thank you.
Thank you so much. For committee members, before we go into public testimony, I just want to make sure that everyone has the opportunity to ask any additional questions. Do we have any additional questions for our agencies that are present today? Seeing and hearing none, we are going to go into public testimony. The committee staff will now call on members of the public who wish to testify on Resolution 21-005. To our members of the public, you will have 2 minutes each to provide your testimony. For those who are signed in using a computer, please use the raise hand function to indicate if you wish to testify. We're going to go ahead and start with you. Matthew Peterson is going to go ahead and take over at this time to see if we have anyone who wants to testify.
Thank you, Madam Chair. Does not look like we have any hands raised at this time, and we have no callers either.
Thank you. So that is going to conclude public testimony on Resolution 21-0052R. I want to thank everyone for joining us. The hearing on Resolution 21-0052R is now in recess. The committee will likely schedule additional meetings on the resolution in the future to keep the City Council, city employees, and residents informed. We're going to go into just a brief recess for about 2 minutes before we move on to Resolution 21-0005R. Thank you.